Right now, there are over 30 million men in the United States dealing with erectile dysfunction, and the majority of them believe at least one thing about it that is completely, scientifically wrong. And those wrong beliefs, they are keeping men stuck, embarrassed, untreated, and suffering in silence for years, sometimes decades. I'm talking about myths that even doctors haven't properly corrected. Myths that get passed from fathers to sons, from locker rooms to living rooms, as if they were facts. Today, we are done with that. I'm going to walk you through the 5 biggest myths about erectile dysfunction, and I'm going to bust every single one with actual science. Stay with me until myth number 3, because that one shocks almost every man who hears it. Before we dive in, if you're new here, hit subscribe. We cover men's health with no judgment, no shame, just real science. Hit the bell too, so you don't miss this. Welcome back. If you've been watching this channel, you know we don't do fluff. We do evidence-based health education for real men who want answers, not embarrassment. Erectile dysfunction affects roughly 1 in 3 men over 40. By age 70, that number climbs to more than half. So if this topic doesn't apply to you yet statistically, it likely will. And it may already be affecting someone close to you. Now, before I get into the myths, I want to hear from you. Drop a comment below right now and tell me, which of these myths have you heard before? I'll read through them. And if you want me to send you a free guide we put together, the Men's Ed Truth Sheet, just comment the word free down below and I'll get it to you. Comment free below to receive the Men's Ed Truth Sheet, our free guide with all the science from today's video and what to actually ask your doctor. Myth 1 Ed is just a normal part of getting old or nothing. You can do this is probably the most dangerous myth on this list. Dangerous because it convinces men to give up before they even start. Yes, Ed does become more common as men age. We don't deny that. But more common does not mean inevitable or untreatable. Those are very different things. Here's what the science actually says. A major study published in the Journal of Sexual Medicine found that up to 25% of new ED cases in men are actually reversible with lifestyle interventions alone. No pills, no procedures, just targeted changes. And here's the critical piece. ED is often a vascular problem, not just a sexual one. Research from Harvard Medical School describes ED as a potential early warning signal for cardiovascular disease, sometimes showing up 3 to 5 years before a heart attack or stroke. So no ED is not just getting old. It's your body sending a signal. And the right response isn't to shrug and accept it. The right response is to listen. Stay with me, myth number 3 is one that almost every man gets backwards, and understanding it could change how you approach this completely. Myth 2 Ed is always a psychological problem, it's all in your head. This myth goes the other direction, and it's equally harmful. Some men are told or tell themselves that their ED is purely mental. Stress, anxiety, not attracted enough. Think harder. Try harder. Here's the truth. According to the Cleveland Clinic, roughly 70 to 80% of ED cases in men over 40 have a primarily physical cause: cardiovascular disease, diabetes, hormonal imbalances, nerve damage, medication side effects. Now, does psychology play a role? Absolutely. Performance anxiety is real. Depression lowers libido. Relationship stress matters. But in most cases, especially in men past 40, there is a physical driver underneath. The danger of the "it's all in your head" myth is that it makes men feel weak or broken mentally when actually their body needs medical attention. They avoid doctors. They avoid honest conversations. And the underlying condition sometimes something serious goes untreated. If you are experiencing ED, the correct first step is a physical evaluation, blood work, cardiovascular screening, hormone panel, then the psychological piece if needed. Myth 3: only old or unhealthy men get ED. This is the stat that surprises people. Here's the one I promised you, and this one genuinely surprises most men. A landmark study published in the Journal of Sexual Medicine, this one out of Boston University, found that approximately 26% of new ED patients were under the age of 40. 1 in 4. Young men. And among those younger men, nearly half had severe ED. Not mild. Severe, the researchers found high rates of risk factors in that young group: heavy smoking, physical inactivity, and recreational drug use being the top contributors. So this is not a grandpa problem. ED is a health problem, and health problems don't check your birthday before they show up. What this also means is, if you are a younger man experiencing ED and you're waiting until you're old enough to talk to a doctor about it, stop waiting. The sooner you address the underlying cause, the better your outcomes. 2 more myths to go. Myth number 5 is the one men are most relieved to hear busted. Keep watching. Myth 4: the pills are the only real solution. Most men think there are only 2 options. Either take a medication like sildenafil or tadalafil, or just live with it. That's the myth. The reality is that ED has a genuinely wide treatment landscape, and for many men, the most effective interventions are not pharmaceutical at all. Here's what the research supports as clinically effective first-line approaches. Aerobic exercise, a 2018 meta-analysis in the Journal of Sexual Medicine found that aerobic exercise significantly improved erectile function in men with ED related to cardiovascular disease, metabolic syndrome, obesity, and hypertension. Dietary interventions, Mediterranean-style eating patterns, have been linked in multiple studies to improved erectile and vascular function. Nitric oxide support foods like beetroot, leafy greens, and L-citrulline-rich foods support endothelial function and blood flow, the exact mechanism behind erections. Sleep optimization, testosterone is largely produced during deep sleep. Poor sleep is a well-documented contributor to hormonal ED. Psychosexual therapy for cases with significant psychological overlay, structured therapy has strong evidence. Now, are medications sometimes the right tool? Yes, absolutely, but they're not the only tool. And for some men, addressing root causes, circulation, hormones, lifestyle, produces results that are more durable long-term. Myth 5, talking about ED with your doctor is embarrassing, they'll judge you, and here's the one most men are relieved to hear busted. The fear of judgment keeps more men away from getting help than any other barrier. Study after study confirms that shame, embarrassment, and fear of appearing weak are the primary reasons men don't seek treatment for ED. Let me be direct. Your physician is not going to judge you. Erectile dysfunction is the most common male sexual health complaint that doctors see. It is on their intake forms. It has clinical protocols. It has dedicated specialists, urologists, endocrinologists, sex medicine physicians. What doctors do, what they are actually trained to do, is use your ED as a starting point to check the health of your cardiovascular system, your hormone levels, your metabolic markers. ED can literally save your life by prompting health evaluations that catch something serious early. So the conversation isn't embarrassing. It's one of the most health-protective conversations a man can have. And if you're watching this right now and you've been putting off that conversation, consider this your sign to make the appointment. Let's recap what science has actually told us today. Myth 1: ED is just aging. False. It's often reversible and always worth investigating. Myth 2: it's all psychological. False. 70–80% of cases in men over 40 have a physical cause. Myth 3, only old or unhealthy men get it. False. 1 in 4 new cases are in men under 40. Myth 4, pills are the only answer. False. Lifestyle, diet, and circulation interventions are powerful. Myth 5, doctors will judge you. False. This conversation could literally save your life. Knowledge is the first step. And you just took it. Now, if you found this helpful, please share it with a man in your life who needs to hear it. Hit like and comment free below if you want that Men's Ed truth sheet sent to you. And check out this video right here. We covered how nitric oxide affects blood flow in men over 50. It connects directly to what we discussed today.